Welcome. Today we're diving deep into a urinary system disease, a squamous cell carcinoma, often abbreviated as SCC. This relatively rare cancer can affect various parts of the urinary tract. Understanding its origins, how it develops, and what we can do about it is crucial for early detection and effective management. So let's embark on this informative journey together. What triggers squamous cell carcinoma in the urinary system? The exact causes are not always pinpointed, but certain factors significantly increase the risk. Chronic irritation and inflammation are prime suspects. Think long-term bladder infections, kidney stones, or the prolonged use of urinary catheters. Schistosomiasis, a parasitic infection common in some parts of the world, is also strongly linked to SCC of the bladder. Smoking is another major culprit, as the carcinogens in cigarette smoke are filtered through the kidneys and excreted in the urine, exposing the urinary tract lining to harmful chemicals. Finally, exposure to certain industrial chemicals, like those used in dye manufacturing, can also elevate the risk. Let's understand how SCC develops. It all begins with changes in the squamous cells, the flat cells that line the urinary tract. Chronic irritation or exposure to carcinogens damages these cells' DNA. This damage causes the cells to grow uncontrollably and abnormally. These abnormal cells then multiply, forming a tumor. As the tumor grows, it can invade surrounding tissues and organs, potentially spreading to other parts of the body through the lymphatic system or bloodstream. This process, known as metastasis, is what makes SCC a potentially life-threatening condition. Squamous cell carcinoma of the urinary tract is not as common as other types of urinary cancers, such as urothelial carcinoma. The incidence varies depending on geographic location and risk factors. In regions where schistosomiasis is prevalent, SCC of the bladder is more frequently observed. Similarly, populations with high smoking rates also tend to have a higher incidence. Overall, SCC accounts for a smaller percentage of urinary cancers compared to other cell types. Understanding these epidemiological patterns helps us target screening and prevention efforts more effectively. Recognizing the signs and symptoms of SCC is crucial for early detection. Common symptoms include hematuria, or blood in the urine, which is often painless. Painful urination or dysuria is another possible indicator. Frequent urination, a persistent urge to urinate, and difficulty urinating may also occur. In advanced stages, patients might experience flank pain, weight loss, fatigue, or swelling in the legs due to lymphatic obstruction. It's important to remember that these symptoms can also be associated with other conditions, so it's vital to consult a healthcare professional for proper evaluation. Diagnosing SCC typically involves a combination of methods. First, a thorough medical history and physical examination are performed. Urine tests, including urinalysis and urine cytology, can detect the presence of blood and abnormal cells. Imaging techniques, such as CT scans, MRIs, and ultrasounds, help visualize the urinary tract and identify any tumors or abnormalities. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows for direct visualization of the bladder lining and the collection of tissue samples for biopsy. A biopsy, where a small tissue sample is examined under a microscope, is essential to confirm the diagnosis and determine the type and grade of the cancer. While SCC is a distinct type of cancer, it is staged based on the extent of its spread. The TM system's tumor node metastasis is commonly used. T describes the size and extent of the primary tumor and indicates whether the cancer has spread to nearby lymph nodes. M signifies whether the cancer has metastasized to distant sites. These stage groupings guide treatment decisions and provide important information about prognosis. Understanding the stage of the cancer is crucial for developing an effective treatment plan. Treatment for SCC of the urinary system depends on the stage, location, and overall health of the patient. Surgical removal of the tumor is often the primary treatment option. This may involve partial or radical cystectomy for bladder tumors or nephrectomy for kidney tumors. Radiation therapy, which uses high-energy rays to kill cancer cells, may be used before or after surgery or as the primary treatment for patients who are not suitable for surgery. Chemotherapy, which uses drugs to kill cancer cells throughout the body, may be used to treat advanced or metastatic disease. Immunotherapy, which helps the body's own immune system fight cancer, is also showing promise in treating certain types of SCC. A multidisciplinary approach involving urologists, oncologists, and radiation oncologists is often necessary to provide the best possible care. Prevention is always better than cure. While not all cases of SCC can be prevented, certain lifestyle modifications can significantly reduce the risk. Avoiding smoking is paramount. Staying hydrated by drinking plenty of water helps flush out toxins from the urinary tract. Practicing safe sex can help prevent schistosomiasis. Prompt treatment of urinary tract infections and kidney stones can help prevent chronic irritation and inflammation. Regular check-ups with a healthcare provider can help detect any potential problems early on. The prognosis for SCC depends on several factors, including the stage of the cancer, the patient's overall health, and the response to treatment. Early detection and treatment are crucial for improving outcomes. Recent research is focused on developing new and more effective treatments for SCC, including targeted therapies and immunotherapies. Scientists are also working to identify biomarkers that can help predict which patients are most likely to respond to specific treatments. Advances in surgical techniques, radiation therapy, and chemotherapy are also improving survival rates and quality of life for patients with SCC. The future of SCC treatment looks promising, with ongoing research paving the way for more personalized and effective therapies.